The first medication that we're going to go through in Core Medical Group's video series is how to inject and draw out your testosterone. Testosterone comes from the pharmacy. It will be received at your home. You'll have to separate it from the other medications, and there'll be a plastic stopper on the top. This must be taken off prior to doing your injection and drawing. When receiving the medication, it's very important that you have your alcohol prep pads. Before doing any injection, you need to clean the top of the stopper off with the alcohol prep pad as well as the injection site. The syringe used to draw your testosterone is going to be a 20 gauge, 1 inch, 3 ml syringe. This is strictly used just to draw out the testosterone. You'll have your testosterone in your hand that is your non-dominating hand with the syringe in your right hand. Making sure that the head is tight, you're going to take the full needle head, go directly into the center of the stopper, and draw out until you have 1 cc of testosterone. This process takes a little bit of time, but be patient and make sure that exactly 1 cc is in your syringe or whatever the recommended dose is from the physician. Once this is completed, you're going to remove it out of the testosterone and then put the cap back on your syringe head. Removing this syringe head, then going to your injection needle. The injection needle is much smaller than your typical draw head. The reason being, we use a very large syringe to draw your testosterone out so that it flows easily into the stopper. A 23 gauge 1 inch head is most commonly used in the glute. We use a 5/8 to a 1/2 inch 25 gauge in the shoulder. In some cases, our physicians will prescribe both testosterone and vitamin D3. These are both oil-based. They will both actually end up in the same syringe prior to injection. Standard protocol is 1 cc or 200 milligrams of testosterone as well as a 1/2 cc of vitamin D3. These will both be drawn into the same syringe and injected. Prior to me starting the full explanation of how to draw your vitamin D3 as well as testosterone into one syringe, the first thing that you need to know is you always need to start with your testosterone draw. The reason for that is you do not want the testosterone to get inside the D3 at any cost. I'm going to start by going into my testosterone bottle. Once again, I'm going to go into the center stopper after cleaning the head of the vial and draw 1 cc of testosterone. Once I have that 1 cc, remove the needle head from the bottle, then go into my vitamin D3. This sometimes can be tricky, but with some practice, you'll become a pro. Directly into the center of the vial and draw back a little bit over the 1/2 cc marker. Your total volume of injection will be 1.5 cc's once this process is complete. This first video just went through how to draw vitamin D3 and testosterone into the same syringe. Shortly we will be getting to your full injection, different options of injection sites. Currently right now, we have a testosterone in D3 loaded into a syringe. I explained a 200 milligram with a 1/2 cc injection of vitamin D3. Protocols may vary. On behalf of Core Medical, I'd like to thank you for taking the time to watch this video. Please understand that these videos are not a last resort. Our staff, patient coordinators, and physicians are here at all times to assist you with any of your goals, questions, or needs, especially when it comes time to inject your medication or if you have any questions on exactly how the medication works. Core Medical has locations all across the country. For additional information, please feel free to contact any location. And once again, we thank you so much for your time today.